Okay. Uh, this is Dr. Meenakshi, working as an assistant professor in Department of Kaumarabrithya, Ashwini Ayurvedic Medical College, Tumkur. So today I came here, or this session is held on a topic of Kaumarabrithya orientation, exam orientation session. In this, we'll discuss about the exam orientation, maybe particularly about the subject of Kaumarabrithya, how the pattern is of exam is, and uh, what all, like how you can manage time in a session, and how the questions will be, everything we will discuss about, particularly about the Kaumarabrithya subject, right? So when point comes of exam, that is, what is this exam, how, what all points we need, how we will cover, that all is other matter. The main point or main result of this session will be like fail or pass, nothing but failure or success, right? So failure or success is a social concept, right? Generally society tell, if you getting a failure and a success, comment on it, everything, maybe on exams, or maybe your lifestyle, or maybe your any business project, everything society will comment on it, right? We all have faced this moment in every situations, or in one or other situations. If you have any exams or a moment, when we start a new project, not only exams, if you didn't get success in it, then people start commenting, oh, this time, not this time also, or again he or she could not clear the exams, the society will comment on this, right? This is a kind of tax of failure that society will put on you. But here the problem is, we ourselves don't seem that we consider ourselves as a failures, but society make us failure or a success. The society will tag, will give a tag for our maybe success or failure, right? The moment somebody is trying to put a tag on you, see through to, not them should directly comment on you, or no, not they are the persons to decide whether you're a failure or success, right? Because no one want to get a failure, or no one want to get a fail in exams. But the matter is, either they will not be having interest on it, or the seriousness of a matter will not be knowing to them. So without one in one or other matter, without interest or without seriousness, they will get fail. For example, now students also, uh, students will write exam, no one want to get failed, right? Everyone, even a student who is zero in scoring the marks also, will feel that, huh, I should get pass all subjects, right? No one want to fail. But your interest towards the study, or your seriousness towards the study, or your seriousness towards the exams, will make them. If you're seriously studying, obviously you will get clear. But if your seriousness is bit um, low, or if you're not finding the way how to clear the subjects, or how to study the subjects, then in that condition some will get failed, right? But to shut the society's mouth, you should create seriousness or interest in you, and you should get clear all the subjects, not only for society, but for yourself also. Because that's a secondary matter, that society speaks about you, parents scolds you, or any other matter. But when matter comes of life, you're the role model in your own life, right? You should rule your life. If you get clear the subjects, and if you move on further, you can get settled in your life, and it will be very helpful for you. But if you lag behind, again this tag, failure tag, will be tagged for your life, and you will sit behind, right? So for that reason, for yourself, you should create a awareness, and you should move on, you should clear the subjects, right? So there is a proverb for this, especially the interest and motivation, like seriousness. I remember one proverb that, when your mind is weak, situation is a problem for you, right? But when your mind is balanced, the situation is challenge for you. And when your mind is strong, it becomes a opportunity for you, right? It's a especially this will be applicable for students. If you are well versed and if you are confident, obviously your mind will be like opportunity. This is an opportunity. I should move on. Like that it will be. But if your mind is weak and you are not confident, obviously the problem seems to be problem or a big task for you, right? So, by stating this proverb, we'll start the session. That is, according to Kaumarabrithya, how the question pattern will be, how what are the syllabus present, and what all points we should cover. Right. First of all, the question paper pattern. This was a pattern. What I'm explaining was followed till last year, and for now it's the same. But don't know, due to some maybe counseling meetings or due to some feedback, sometimes our university or CCM will MCSM will change the pattern. Till now, what we followed is the Kaumarabrithya subject totally is of 100 marks and single paper. There is no two papers, only single paper, and uh, the part A, sorry, paper one, single paper, and there are two portions, that is part A and part B. Part A consists of 50 marks and part B consists of 50 marks, both 50-50 marks, 100 marks theory question paper, and practical marks will be 75. That is 75 marks for practical. Includes practical questions and viva voice. That is, practical questions means spottings will be one long question related to case history and one short question related to theory question. And lastly, 25 marks for viva voice. This is 75 marks, and rest, that is 100 marks will be theory. In that theory, 10 marks 2 questions, 5 marks 10 questions, and 3 marks 10 questions. This is a question paper pattern. And coming for, as we got to know pattern, now many students will be having doubt that for how much marks, how much we should cover, how much marks questions, how much pages we should write, because many students don't know that for how much marks, how much pages, like how much explanation you should write. Some will write only half of page, some will write only single page. For 10 marks, which I said 10 marks 2 questions, for that you should write 3 pages, that is 6 sides. And for 5 marks you should write 2 pages, or if the question is nearer or the explanation is more, you can reach to 3 pages also, like 4 sides or 6 sides you can write for 5 marks. And for 3 marks, either you can write single side or you can write 2 pages, that is 2 sides. This is a pattern of marks. Depends on these only you will get a marks, that is 10 marks 3 pages, that is 6 sides. 5 marks 2 to 3 pages, that is 4 to 6 sides. And 3 marks single side or double side. These also how you should write, that is to ma'am said that we should write 6 sides for 10 marks, so you will go on fill whatever you know. Not, no, that's not the right way. How you should write is, one thing, write point voice, don't write in a paragraph way, write in a point voice way. Keep heading, mark the heading with the color, maybe pencils or blue pen, because you're writing. Another point I forgot to mention, that compulsorily you should use ball black pen, so that if the scanning is done, your answer papers will be scanned, right? If your scanning is done, the clear answers will be clear in a scanning. Or if you write in a blue pen, or if you write in a ink pen, or if you write in any light color pen, it will not be visible clearly in scan and your marks will be cutted. So write dark ball, that is black pen you should use, so that. And what how you should use, you write the heading and write in a point wise, don't write in a paragraph, because no one will be having so much patience to sit and read all your answers, right? If you write in a point wise. And another thing, make a chart wherever necessary, so that it will be clear for the audience, sorry, it will be clear for the evaluators that the matter is clear. In a chart, single chart, they will get to know how much student is knowing about this topic, right? So mention the charts, write in point wise, and cover the pages, and specially uh, don't write less than these identified or mentioned pages, because if you write for 10 marks, if you write only single page, they will not give any marks, only 1 marks you will get, though your answer is perfect, right? So try to expand the matter, but don't write silly things, write the related topics, related points, one thing. And another thing is, um, as I said, write point voice, and whatever you know, write it clearly. That is, don't and coming for the marks, which question when we should write, like don't write 10 marks question at the beginning, because how the matter will be here, though you write 6 pages for 10 marks, full 10 marks they will not give, anyone will not give, maximum they will give you 6 to 7 marks for 10 marks, right? So don't waste your time in writing 10 marks in a beginning, though you are perfect, write it in at the end. If you are perfect, then write it in a specified manner, like um, whatever you know, mention the charts, mention the points, so that obviously they will give 5 to 6 marks if you write only 2 to 3 pages also, right? But in 3 marks or 5 marks, whichever answers you are perfect, that you write in a beginning, to cover the timing in a exam, because it will be very big task to complete all the questions in 3 hours, right? So complete the 3 marks and 5 marks first, then last half an hour you keep for the 10 marks question. First 2.5 hours you complete 5 marks and 3 mark questions completely. Then last half an hour you keep for 15 minutes is enough to write the 10 marks, right? Last half an hour you can keep for the 10 marks. This was about the question paper pattern and how you should write and in which manner you should write. And next, coming for student life. Student life is a golden life. We have proverb only, right? But no one want to study here fully seriously. Everyone want to enjoy, everyone want to chill out, right? Everyone want their entertainment. No one are very serious about studies. In whole 100, one or two will be who are very serious in studies, rest all want to enjoy their life, right? But I'm not saying here you should not enjoy, only you should study. But study matters first, rest all matters later, right? If you study and if you move further, it will be a better way. Of course, the enjoyment also needed in a student life. You should enjoy your life, but at the end you should study also. You should clear your course also, right? Many students will study 12 to 14 hours continuously a day during exam, but toppers will be the students who studied 3 to 4 hours, or the students who studied aramse, right? You may be observed this, or you may be experienced this also. The students who, like studious students who are bookworms, they will study whole year, but they will not get top. The students who studied during the exams, they will be topper. What the reasons for this? Have you thought? The reason for this, I'll say at the tips at the end of the session, tips when I'll give at that time, I'll give the reason why this will happen, especially. uh, and next, coming for, because studying like bookworm is no needed, but study with perspective. Like bookworm, if you study whole textbook, it's no use. Study with the perspective, study with the interest. And we can like students discussing, I'll see, like some will say I studied yesterday whole day, or some will say that I studied 3 to 4 hours continuously yesterday, or some will say that today morning, early morning, I got up at 3 o'clock only, and I started studying. And the matter will be like, these all you will do, but what will happen? Yeah, though you studied 3 to 4 hours, or though you studied early morning, or though you studied fully, like full night, like 3 o'clock. Some will say that yesterday night till 3, 4 I studied, but what will be remaining in your mind after all this? Only 1% study, whatever you studied will remain in your mind, and rest all will be vanished when you revise the syllabus, right? Have you experienced this? Why this happens? And have you thought any time that though so much I studied yesterday, 3 to 4 hours I completed whole the topic, but when I revised today, nothing is in my mind. Only top questions or top points I am remembering. Whole thing is vanished from my mind. Why this will happen? Have you thought any time? No, right? In our for example, in class also, in yesterday's class, whole 1 hour we will be explained other topics in other way. But when we ask a question today, nothing will be there in their mind. But that's the other matter, right? Like no one will listen the class carefully, right? That's the other matter. But though if you listen also, some 1 to 2% will be in your mind, and rest all will be vanished. Nothing will be in your mind. For these also, I'll say the reason in the end. When I'll say the tips why to study and how to study. At that time, I'll say the reason. And now coming for solving the syllabus. This whole Kaumarabrithya syllabus will solve in 10 to 20 minutes, right? We'll see. I can solve this briefly, not like explanation for whole 1 year. We need to explain all the topics, right? But briefly to all whole Kaumarabrithya, what all points it's covered and how you can remember the things, I'll make it in a shortcut way. So we'll move on to the syllabus. That is part A. First, we'll see the part A. First point is general introduction, scope, and definitions of Kaumarabrithya. Right. Remember this pattern so that you will get easy in remembering the points in exams. First point consists of general introduction, scope of Kaumarabrithya, and definitions of Kaumarabrithya. This point is very important, right? Because as we are dealing with the Kaumarabrithya, we want to know introduction of Kaumarabrithya, how it formed, and when it was started, everything, and scope of Kaumarabrithya. That is why separate branch for Kaumarabrithya we need to know, and definitions. Obviously, when subject comes, its main definition is a main thing. So first point covers these 3 points. Moving to the second point, contribution of Kashyapa Samhita to Kaumarabrithya. Especially, no need to say it, right? You all know who is Acharya Kashyapa, right? Why he particularly explained Kaumarabrithya, and especially as he is the father of Kaumarabrithya, what all his special contribution towards the Kaumarabrithya is explained in second point of part A, right? Then coming for third point, age classification. That is Vayobheda according to different acharyas. In these two, specially according to Kashyapa, you need to by heart specially, because as he is the father of Kaumarabrithya, you need to know age classification particularly about him, because he gave a different way of age classification, right? Where rest all started from birth, he started from Garbha, right? So you need to remember. And another one is according to Sushruta, because he divided the age according to diet of a baby. And another one is Harita, according to Acharya Harita, because he gave separate point, like separate name has a mudga for the girl till 5 years, right? So these was the third point according to syllabus topic, that is Vayobheda. Coming for fourth point, that is Prana Pratyagamana. What is this Prana Pratyagamana? Neonatal resuscitation. They explained Prana Pratyagamana, especially when to do, how to do, explained, and what are steps you should cover in neonatal resuscitation. It's explained. And this Prana Pratyagamana is one of the procedure in Jata Matra Sishu Paricharya, right? Fourth point. We completed 4 points. That is, fourth point is Prana Pratyagamana, that is neonatal resuscitation. Then coming for fifth point, that is Navajata Sishu Paricharya. What is this Navajata Sishu Paricharya? Many will confuse here. Navajata means they will write our modern neonate age, that is 28 days. But according to our acharyas, who is Navajata, from birthday till 120 days, the baby is known as Navajata Sishu, right? So they explained what all procedures according to our acharyas should be covered in Navajata Sishu Paricharya. They divided into three categories again: Jata Matra Sishu, Sadyo Jata Sishu, and Navajata Sishu. Whereas Jata Matra Sishu is, they explained the particular procedures from birth till cutting of umbilical cord. Whereas Sadyo Jata Sishu is from birth till 24 hours, and Navajata is from birth till 120 days. Again, don't confuse here. If they gave Navajata Sishu Paricharya, obviously you should explain all the 3 points, that is Navajata procedures, Sadyojata procedures, and Navajata procedures. But if they ask only Sadyojata, you should write both Jata Matra Sishu Paricharya procedures and Sadyojata. Because who is Sadyojata? From birth till 24 hours, right? So all the procedures of Jata Matra Sishu and Sadyojata Sishu you should explain. If they ask only Jata Matra, then you can write only Jata Matra Sishu Paricharya's procedures. So this was about the Navajata Sishu Paricharya. That is fifth point of part A. Coming for sixth point, they explain Navajata Sishu Parikshana. Especially in this point, according to our acharyas, they explained Ayu Pariksha, right? So the sixth point consists of examination of newborns. Remember, not the all children, only newborn examination on first day or during the first week of birth, or like immediately after birth, like Apgar scoring, everything. Newborn examination, what all we will do immediately after birth within one day or 24 hours. That was explained in Navajata Sishu Parikshana. Especially according to our Acharyas, they explained Ayu Pariksha, that features of a newborn will be dependent on future life. So these special features, special Ayu Pariksha, they explained particular parts, how their features will be according to their future will be. This they explained in Navajata Sishu Parikshana. That is sixth point of part A. Coming for seventh point, Navajata Sishu Poshana. Remember, Navajata Sishu Poshana, not the children. Navajata Sishu Poshana means obviously the breast milk, Stanya, right? So they explained about the breast milk, Stanya Nirmana physiology, or the how the breast milk should be, ideal qualities, and which form you should feed. If there is insufficiency of breast milk, then what you should do. These all they explained in Navajata Sishu Poshana, right? Then coming for eighth point, Stanya Dosha. This is next part of the Stanya. There we there in Stanya Navajata Sishu Poshana, we saw what are the ideal qualities. If there is insufficiency, what we should do. Next coming is Stanya Dosha. If the breast milk is vitiated, and how the clinical complaints will be in baby, and for purification, what all we should do. And Stanya Janaka, to increase the breast milk, what all we should include. The diet or medicines in a mother, they explained in eighth point. Coming for ninth point, Garbha Vriddhi Vikasa, that is growth and development of children. With this Garbha Vriddhi Vikasa, from the day of conception till the adolescence, how the changes will be, growth and development will be in baby, and in modern part, milestones they explained in ninth point. Coming for 10th point, Poshana, that is Poshana means, there we saw only Navajata Sishu Poshana, only breast milk. In this Poshana, after the breast milk, how much quantity of nutrients, or maybe the overall nutrition, in which form and how much quantity we should give, they explained in Poshana point. And coming for 11th point, Dantotpatti evam Danta Raksha Vidhi, that is dentition. When the eruption of teeth will be, what all the diseases may cause, what are the ideal qualities, what are the um, like disqualities of a teeth. These are they explained in Dantotpatti, and especially during the dentition, what all clinical symptoms will be, complaints will be, or disease will be to the baby. They explained in 11th point. And 12th point is about Vyadhi Kshamatva, that is immunity. And like how the immunity of a baby will be, how we can promote it, and what are the types of immunity. These all they explained in Vyadhi Kshamatva. Coming for 13th point, Prashana and Lehana, that is nothing but the prashana, according to our Acharya, Jata Karma procedure is one of the prashana, right? So, what is this prashana? How they should give, and what are the indications? What all are the contraindications of prashana and lehana, and in which form? Like we will divide the prashana or lehana into healthy baby and diseased baby, right? So these all they explained in prashana and lehana, especially in this. Again, they explained about the Swarna Prashana, Hematri Prashana, everything which are forms of prashana also they explained. And coming for last point of part A is 14th point, that is knowledge of national programs related to child health care. This they explained in last point. So this completes the part A of Kaumarabrithya syllabus. Very easy, right? To complete, to briefly completion, it's very easy. But the inside matter you have to read, particularly what all matters you should include in it, and if different acharyas what particular acharya said about these points, you should fill it inside, right? This was about the part A. It's very like basic points are covered in part A. Coming for part B, it's bit lengthy compared to part A, and in this part B is filled with every diseases, right? You all know it. uh, we'll move to the part B, that is first point, that is Bala Pariksha Vidhi, that is examination and diagnosis. For in newborn, Navajata Sishu Parikshana, what we saw, only newborn examination on first day, or if any complications, what all we will do, or newborn routine examination, we will see in Navajata Sishu Parikshana. Sorry, Parikshana. But here in Bala Pariksha Vidhi, childhood after the newborn stage, the diagnosis, what all complaints will be, and what all examinations we should do according to type of diseases, will see in Bala Pariksha Vidhi, that is part B, first point. Coming for second point, our acharyas explained general Aushadhi Matra Nirdharana, because we need this particularly in Kaumarabrithya. It's very necessary, because why? Obviously, we divide the dosage of the medicine according to the age of a child, according to weight of a child, or according to some diseases, according to or some drugs according to tolerating capacity of a child, right? So we should know in which form or in which situation how we should calculate the dosage of drugs, right? So they explained in second point about the Aushadha Matra Nirdharana. They explained in second point, according to different acharyas they gave different forms, and according to modern they gave some formulas. These are very necessary, not only for exams, even for your future practice also you need this, right? So you should see particularly about the formulas of a Aushadha Nirdharana. Then coming for third point, specific therapeutic procedures in children. As we all know, Ayurveda is fully dependent on either Shamana Aushadhis or Shodhana procedures, right? Shodhana procedures are nothing but Panchakarma. But here, again, when the matter comes of children, as we give in or as we advise the Panchakarma procedures in adults, we can't give in children, right? Particular according to their conditions or according to their age. Some procedures are only advised after 1 year. That all we should see. And especially when we use Deepaniya Pachaniya drugs in Panchakarma procedures, we should know in which form and in which situations the Panchakarma is necessary, right? Obviously, as children's or acharyas explain, you should treat a baby with the Shamana Aushadhis only. If the treatment is not clear from Shamana Aushadhis, then go for Panchakarma procedures. That all they explained, and particular Panchakarma procedure, in which form and in which conditions you should give, that all they clearly explained in third point. Coming for part B, fourth point, Prasava Kalina Abhighataja Vyadis. From here, the main matter starts, because from here, the particular diseases starts. If, for example, if Shwashavarodha is given in question paper, you know what is Shwasavarodha. That is obviously that, like if you're a medical field and you completed 3 years in BMS, at least you will be knowing what is Shwasa Avarodha, right? Shwasa means respiratory and Avarodha means obstruction. So that you will get to know how this is obstruction of respiratory. Though you don't know what is this disease, at least you can split the disease and you can mention the respiratory disease. But if you don't know in which category this disease will come, then your whole answer will be wrong. If you write Shwasavarodha in congenital diseases or Sahaja Vyadis, then obviously, though you wrote the whole disease correctly, that clinical features, diagnosis, treatment, though you write all the way correctly, but if your heading is wrong, that this disease is Sahaja Vyadis, then obviously your whole answer will be wrong. They will not give a single marks. So from here we so for that reason only they gave particularly the heading of a disease, that categories of a disease, and they explain the diseases in a textbook or syllabus, right? So you should remember which disease comes under which category, then only your answer will be correct. Now we will see which all categories will include which all diseases. So first one is prasava kalina abhighataja vyadis, that is birth injuries. What all diseases will include in this? Shwasavarodha, Ulvaka, Upashirshaka, facial paralysis, and Bhagna. These all diseases are explained in birth injuries. And again, in diseases, no need to explain. In Rog Nidana in second year already you learned how to explain the diseases in a pattern, like, right? First, you should write the definition, or like in which category that disease will come, and causes, complaints, samprapti, diagnosis, and the treatment, line of treatment. Everything you should explain clearly, right? And especially in Kaumarabrithya treatment, in some particular categories, the treatment will come for mother also and baby also, particularly when the baby is of Shirapa and Shira Annada, right? Because if we treat or if we give medicine for only baby, it will not cure. And in some conditions, we can't give this Tikshna Dravyas for directly for baby. So how the way we will do? We will apply this for the nipple of a baby, and we will make the baby to swallow it while breastfeeding, right? So when Shirapa and Shira another disease comes, you should mention the treatment, how you will give the treatment for mother and for baby. And in another condition is Thanya vitiated diseases like breast milk vitiation diseases. Again, there we will give both the treatment, mother and baby. You should mention it. And coming for next, Sahaja Vyadis, that is congenital disorders. The disease includes Sahaja Hridaya Vikaras, Jalashirshaka, Kandoshta, Kandatalu, Sanniruddhaguda, Padavikriti, Spina bifida, and meningocele or meningitis. These all diseases will come under Sahaja Vyadis. Coming for genetic disorders, that is Down syndrome, Turner syndrome, muscular dystrophy, sickle cell anemia or thalassemia, and Sahaja Madhumeha. These 5 diseases will come under genetic disorders. And Prasavottara Vyadis, that is Prasava Uttara. Prasava next, that is neonatal disorders. You can remember, you should split the words, then you will remember very easily. Neonatal disorders are Navajata Shishu Kamala, Navajata Netra Abhishyanda, Nabi Rogas, uh, till cutting of umbilical cord or complications we'll see there. But after the cutting of umbilical cord, complications of diseases comes under Nabi Rogas, Navajata Sishu Rakta Vishamyata. These 4 diseases will come under Prasavottara Vyadis. Coming for Dushta Stanya Pana Janya Vyadis, that is Dushta Stanya Pana Janya. Due to vitiation of breast milk, disease will be caused in babies. Those are lactose intolerance, Kshilalasaka, Kukunaka, and Ahiputana. These 4 diseases will come under Dushta Stanya Pana Janya Vyadis. And next is Kuposhna Janya Vyadi, that is nutritional deficiency disorders. What all are those? Karshya, Fakkaroga, Balashosha, Parigarbhika, vitamins and minerals deficiency disorders, and failure to thrive. These all diseases will come under Kuposhna Janya Vyadis. Here also, for example, if they gave Fakkaroga, if you don't know in which category it will come, obviously your clinical complaints will be like, if you remember, you can write But if you remember the category, Pakka means nutritional deficiency, obviously the clinical complaints will be in front of your eyes. You can write aram se, right? So remember the categories, that which diseases comes under which category, so that you can remember or you can explain the disease very well. If you didn't study that disease also, if you remember in which category this disease will come, so you can attempt clearly the though you don't know perfectly, at least you can attempt on 50% basis, right? So next is Upasargika Vyadis, that is infectious disorders. What all disorders will come under this? Karnamola Shota, Romantica, measles, rubella, masurika, rohini, kukurakasa, dhanurvata, and krimi roga, antrika jvara, Mastishka Avarna Shota, dengue and malaria, they explained in this, and Raja Yakshma, these all will come under infectious disorders. And next, they explained about the, after this 10th point, they explained in sub points. That is, first point, they explained about Stroto Rogas. Every particular system of a body have particular different diseases, right? Example, respiratory have Kasa, Shwasa, these also. According to systems of a body, they explain in though we have system-wise diseases, some particular diseases we have which will caused only particularly for children. Those all are apasmara, akshepaka, niruddha prakasha, and cerebral palsy. These four are the diseases which are mentioned under Anyabala Vikaras. Then next is behavioral disorders of children. Some behavioral disorders we have, which we see particularly in children. Those are breath holding spell, Shayamutra, Paika, Unmada, autism, ADHD, and Jadatva. These all are the diseases which comes under behavioral disorders of a children. And next, coming for Prana Raksha Vidhi. Next point is about Prana Raksha Vidhi. That is the points in emergency conditions, how we should treat and how we should manage the condition. They explained some particular points, they explained of emergency conditions. Those are shocks or anaphylaxis, poisoning. Poisoning is very common in children, not wantedly or by mistake. That because children will not be knowing that if what we eat, what will happen, which is good and which is wrong, right? Whatever they see or whatever they find new thing, they want to taste it, right? So poisoning is very common, especially like maybe floor cleaning thing, or maybe petrol, like because petrol will feel like there is juice in that, so they will start drinking. Or the phenol which we clean for um, household floors, these is common. Or any small things, by playing they will keep in mouth, it will be swallowed. These all are very common in children. So how to handle these situations, they explained, like body and respiratory tract. And hemorrhages, these also common because while playing, from where they will fell or from where they get injury, we don't know. Because due to this, there may be hemorrhages or injuries, main injuries, how we should handle, they explained. And acute renal failure, febrile convulsions are also common. And status asthmatic, and fluid and electrolytic management. These all they explained in emergency conditions. That is 14th point. And last point is about Bala Graha, that is microorganisms. This especially grahas according to different acharyas they explained. And this comparison of graha into modern scientific way they explained. This grahas also, one particular compulsory one question is compulsory in exams. So this completes the part B. This is bit lengthy, but if you remember, as I said, if you remember according to categories, then it will be very clear for you to remember the things, so that you can write easily. And coming for practicals, this was about the theory. Coming for practicals, as I mentioned, um, one long question will be one short question, spottings, and viva voice. This will be the pattern of practical. So this was a whole question paper pattern of Kaumarabrithya, and the syllabus of Kaumarabrithya, what all points are covered in Kaumarabrithya and which point you should read. I mentioned briefly. Inside these explanations you should study and you should make it clear. Right. And next thing is some tips. I said prior, some tips I'll give, I'll say the reason, right? So I'll explain the tips how you should cover. That is, what all tips you should follow while studying, especially. What all tips you can follow? As I said, firstly, uh, study calmly. Don't worry to complete syllabus, because what our students will do, they will be hurry in completing the syllabus, so that they can't remember the points to what all, like especially what all points is remaining, or what all points we should cover. Just they will be having in mind that we should complete the syllabus. They will not think that um, uh, everything will vanish in hurry. They will not think. So study calmly. And next thing is, don't prefer bed to study. What will happen in bed? Huh. If you will be very eager to get up and study, will be planned according to timetable. And when I say timetable, another point I got to know about the timetable, I'll say. So preferring bed, why I'm saying no is, you will get up in the morning, you will sit on the bed and you will study. One thing, what will happen in sitting, you will feel discomfort, so you will start to bend. And due to cool wind in the morning, you will take the blanket on your legs, and slowly by lying down, what you will do, you will sleep and study. But your book will be on your hand, but you will be in sleep, right? This will happen in many times. This will happen with students, right? Even when I was studying, this was happening with me too, right? So don't prefer bed. Make your own place. If you're studying on chair and table, it's very good. Make one particular place to study. You can continue your studies. Don't prefer bed. And write the topic once after studying, or on blackboard. If you are not interested to write with pen and pencil, keep a blackboard. Now we are getting many ways of blackboards, right? Or for best is your any neighbors or any children in home, slates and chalk pieces, right? So whatever you study, you write it once, so that, because why, everyone will say this, whatever you study, write it once. Why they will say you do you know? Because, for example, now only take pen and pencil in your hand, write any word, write shock. You will to write a shock spelling, will you think once what is the spelling of a shock as such? No, right? If you know, obviously you will be knowing the spelling of shock, immediately you will write. Because if we write once, it will be printed in our mind, so there is no need to remember what we want to write. That only, instead of shock, if I say any medical terms like terminologies, if I say, once you will think how we should write that, right? Because you will not be knowing what is that word. So practice once, whatever you study, practice it once by writing. And don't study for longer duration, like as before I said, 2 hours, 3 hours you will study, or whole day you will study. Everyone will say, don't do this. Study in short manner, because, as I said, though you may be having satisfaction, right, that you studied for 3 hours, you studied for 4 hours, but that will not be in your mind. Take a break of 40 to 45 minutes. If it's a single topic, small topic, complete it in a one session, and leave it. Don't study for longer duration, nothing will be in your mind. Take a break. Break means, again, not the entertainment or gadgets or TV. Just have a fresh walk, or have a cup of warm water, or have a cup of warm tea or milk if you need. Then take a break, and take a break of some duration, and continue your studies. And coming for next point, discuss with your friends what all you studied. Because discuss means not like class or a theoretical topic. Just discuss friendly discussion you make with your friends. Like, for example, now I said Navajata Sishu Paricharya. Just have a look on Navajata Sishu Paricharya, what all points it will cover. The 3 points. In 3 points, in Jata Matra Sishu Paricharya, what all procedures you should write. Just discuss, has a friendly discussion. Because have you observed any point or any joke when you discuss with your friends, or when you discuss in a community like 2 3 members, you will not forget that. And another thing, only if you listen, like, to for example, now topic, as I am taking Navajata Shishu Paricharya, I explained, you listen, you will remember it for some days. Later, if you will forget. If anyone say about that, then your brain strikes. Before also I heard this. Your brain will strike, but you will not remember perfectly. But that only you try to explain it, because listening, you did same listening point in whole 1 year also with lecturers, right? But nothing you remembered. So try to explain it for others. Best example is, in hostels they can do this. Roommates will be, or any other friends will be in hostel, they can do. What about the single person who is sitting in home and studying? Best thing is, take a camera, sit in front of mirror, or take your mobile camera. You explain it, has your remember, has imagine your friend is sitting in front of you, or imagine you are taking a session for anyone like me, and explain the topic, what all you studied. The best way to express the feelings, what all you remember, so that you will remember all things. And if you miss anything, you can recap it. I missed this, so that it will be remembered very well. With this, next step is, have a good sleep and food. What our students will do, they will leave food, they will leave sleep, continuously study, but it will hamper your health. In the time of exams, you will be ill health, and you will suffer with the diseases, and you can't write with the concentration, right? So concentrate on your sleep and food also. And next thing is, don't take stress. It will hamper your memory power. For example, best example for stress is Viva voice, your practicals, right? When you will be in Viva, though you know the answer, when you sit in a front of external and internal, you will be blank. Nothing you will remember, right? So that is the best example. So don't take stress. Have a good sleep even before the day of exam. Write the exam calmly and study coolly. Next thing is, be hydrated. Hydration is very important during studies and during the exams. Due to this dehydration only, many will fall sick, even they can't study, even they can't concentrate on studies. So be hydrated. And next thing is, complete whole syllabus once before 10 days of the starting of exam. Now, before, for example, your exam starts from 14th, right? Before 1st of this March 1st, before this month, February ends, you should complete all your syllabus once. I know, if you complete once also, you will not be perfect, but complete it once, at least the glance. How we made glance now? Not this much brief glance, in a clear way. At least once you complete syllabus once, so that in next 10 days you can revise the topic, so that you will become perfect one thing, and you will not be having any stress during the exams. So that, because before exam day, just you can glance the topics, like how now I explained in the video, like that you can once glance the topics, what all categories, what all points we have, then you can go aram say for the exam. Make a timetable to complete the topics and complete the syllabus. This, obviously, when our students take the study holidays, on that day, for first day only, they will make the timetable. Even I saw like color timetables for subject wise, color timetables you will do, and you will stick to wall near your bed, right? Everyone will do this, but no one will follow it. Only it will be on a bed, on a wall only. It will not complete, or anyone will not complete it, or anyone will not follow it, right? I know this. Don't do that. Complete your timetable according to your syllabus, or according to your time covered. But remember, in completing the syllabus, don't hurry and don't do longer duration study. Split your duration, split your topics, and complete the syllabus in a given time. Even in center, you can take a break. So these was all the tips to cover the syllabus or to study the subjects according to your timetable. So this was the uh, exam orientation session. So hopefully, I think the session was helpful for you all and you will get benefited for it. Thank you. If you have any questions, then you can comment in a comment section box. I'll go through and I'll try to answer it. Thank you.